Hi, my name is Sasha, and I'll be talking about the Agree To tool, talking about the CPG, heel pain, and plantar fasciitis, and this is the 2014 revision. A little background on the Agree To tool. It's appraisal of guidelines for research and evaluation, designed to help assess the quality and reporting practice guidelines. It's composed of 6 domains, with each element of the domain giving a score of 1, which means strongly disagree, to a 7, which is strongly agree. Domain 1, scope and purpose. Overall, the objectives of the guideline are specifically described. In the introduction on page 4, there are 7 purposes that are listed, and so I scored this as a 7. The health questions covered by the guidelines are specifically described. In the introduction on page 3 and 4, it talks about the target populations, interventions, and outcomes. So I scored this as a 6. The populations to whom the guideline is meant to apply is specifically described in the methods section on page 4, published for the use of patients with heel pain and or plantar fasciitis. So I scored this as a 7. Domain 2, stakeholder involvement. The guideline development group includes individuals from all relevant professional groups. In the affiliations and contacts on page 20, a complete list of authors with accolades and affiliations was listed, and so I scored this as a 7. The views and preference of the target populations have been sought. On page 19, it states who is being targeted for the intervention, those with plantar fasciitis. So I scored this as a 7. The target users of the guidelines are clearly defined in the introduction. The CPG is for orthopedic physical therapy management of patients with musculoskeletal impairment. So I graded this as a 7. Domain 3, rigor of development. Systematic methods were used to search for evidence. In the methods, they describe where and when the information for the CPG was obtained, a list of databases used, as well as when the studies they used were published and when they conducted the search for the studies. The search consisted of articles with the search term to include heel pain or plantar fasciitis. So I scored this as a 7. The criteria for selecting evidence are clearly described. In Appendix A, had a list of search criteria for each database that was used, as well as the Appendix B to include search results. I scored this as a 7. The strengths and limitations of the body of evidence are clearly described in the methods section of the CPG, the levels of evidence criteria 1 through 5, as well as grades of evidence A through F. Weaknesses were not discussed, so I graded this as a 4. Domain 3 continued. The methods for formulating the recommendations are clearly described. In the methods section, the articles that were getting reviewed for the CPG were reviewed by 2 independent members of the team. Any disagreements were solved by the team leader. Appendix C also includes inclusion and exclusion criteria. I graded this as a 7. The health benefits, side effects, and risk benefits considered for formulating the recommendations prior to another revision or sooner if any evidence becomes available. And so I graded this as a 7. And as a side note, currently the newest revision is under development. Domain 4, the recommendations are specific and unambiguous. Each recommendation for the examination and interventions are listed, and each has suggestions how to use. So I graded this as a 7. The different options for management of the conditions or health issues are clearly presented. There are multiple high levels of evidence options for treatment of plantar fasciitis, including stretching, taping, foot orthoses, night splinting, as well as low-level evidence such as laser and ultrasound. I scored this as a 7. Key recommendations are easily identified. Page 2 of the CPG is a summary page with all the recommendations for diagnosing, examination, and treating plantar fasciitis, as well as more detail within the body of the CPG. So I scored this as a 7. Domain 5, the guidelines describe facilitators and barriers to its application. I was completely unable to locate any mention of facilitators or barriers for the CPGs, so I scored this as a 1. The guidelines provide advice and or tools on how the recommendations can be put into practice. On page 2 and 3, the summary page makes it easy to navigate and figure out what to do in the clinic. So I graded this as a 7, excuse me. The potential resource is implications of applying recommendations have been considered. There's no mention of potential additional costs, and some of the recommendations need specific special certifications such as laser and dry needling, but there was no mention of any additional costs that are associated with these certifications. So I graded this as a 1. The guidelines present monitoring and or auditing criteria. Some of the recommendations give timelines for effectiveness, such as using foot orthoses for 2 weeks up to a year, night splinting for 1 to 3 months, and taping for a week, but no description of monitoring or auditing of criteria. So I scored this as a 4. Domain 6, the views of the funding body have not influenced the contents of the guideline. Method section describes how funding was provided with the claim that the CPG team maintained editorial independence. Who the funding came from was not reported, and therefore I graded this as a 5. Competing interests of guideline development groups have been recorded and addressed. The method section went into some details about the authors completing a conflict management plan and conflict of interest form provided by the APTA, and any articles that were being reviewed that were written by a fellow team member were reviewed by somebody other than themselves. However, no further details were mentioned, so I gave this a 5 out of 7. Overall, I graded this a 6 out of 7. I think this is a really good CPG. It has good information that's easy to understand, easy to follow, and with good clinical relevance. A total raw score of 138, and I would recommend this for use in the clinic. That's it. Thanks for watching.